Guys, let's see about hydronephrosis today. It is the aseptic dilatation of the pelvic ileal system of the kidney due to intermittent total or continuous partial obstruction to urinary flow leading to atrophy of the renal parenchyma. So we can have unilateral causes which could be classified as intraluminal, intramural and extraluminal. In intraluminal we have the most common acquired cause, that is renal stones, and then we can have sloughed papillae as in diabetes and analgesic nephropathy. Intramural causes can be classified as congenital or acquired causes. In congenital causes we have the most common congenital cause, which is pelvic-ureteric junction obstruction. Here there is failure of transmission of impulse across the pelvo-ureteric junction. It is more common in the left side. And next we have ureterocele, where there is a functional obstruction at the level of vesico-ureteral junction. Acquired causes like carcinoma of the ureter and stricture. Extraluminal causes we can have aberrant renal vessel. Here the treatment is pyeloplasty. We shouldn't try to remove the artery as it can cause ischemia of the kidney. Malignant infiltration as occurs in cancers of cervix, bladder and rectum. Retrocaval ureter, where the right ureter goes behind the IVC. In intravenous pyelography, we can see fishhook sign in retrocaval ureter. Ormond's disease. In bilateral cases, we can have the unilateral causes which is affecting the both sides of the kidney. Otherwise, we can have some intravesical causes like phimosis, meatal stenosis, posterior urethral valve, vesico-ureteric reflex on both sides, and urethral strictures and benign prostatic hypertrophy. Clinical features: the patient can have dull aching pain in the flank, and if there is infection, the patient can have symptoms of fever and hematuria. Hypertension can also be present as a complication. Now we have an entity called as xylem sclerosis. This is intermittent hydronephrosis, which is manifesting as colicky pain, nausea and vomiting, which is relieved by passage of a large quantity of urine, which relieves the obstruction. On examination, palpable, smooth, non-tender, palatable renal mass is felt. CKD is a complication of untreated hydronephrosis. Investigation include urine analysis, RFT, ultrasound abdomen, intravenous pyelography, CT abdomen, and technetium 99M diethylene triamine pentaacetic scan. This detects the GFR and localization of the level of obstruction. Treatment: general management, definitive management. Stones, we have to do ureterolithotomy. Pelvic-ureteric junction obstruction, this can be detected antenatally also. If the